Hello, welcome to the podcast Spinal Moves, a Canadian series about activity-based therapy, an intervention used to improve recovery for people with spinal cord injury. I'm your host, Anita Kaiser. This is the final episode in this series, so today my co-host, Hope Jervis-Rademeyer, and I will be sharing a few highlights of each of the previous episodes, as well as their own thoughts and opinions. So I'd like to start off first by thanking you, Hope, for introducing me to the world of podcasting. It's really been an amazing learning experience, and I'm really interested to know what actually sparked your curiosity to learn about podcasting in the first place, and what made you to decide to create a podcast series on this topic of activity-based therapy.
Thanks, Anita. So originally I went to the ABT Summit, and you can hear more about that in episode 3. And then when I was part of some of the working groups, I got thinking about how we could tell clinicians about ABT fast. I like listening to podcasts, especially series. And so I took a few crash courses, proposed the idea to Dr. Musselman, my supervisor, bought the equipment, and away we went. Thank goodness you contacted me to volunteer your help. Did you know we ended up doing a total of 19 interviews between us?
Yeah, that's quite a lot. Okay, so let's talk about the first episode. This is where we had Dr. Kristen Musselman and Kristen Walden, both as our guests. And, I thought Dr. Musselman gave a really nice introduction and overview of activity-based therapy. And she talked about some of the key components of ABT, like task-specific movement practice and the high dosage. And I also thought it was nice that she emphasized some of the other benefits of ABT, like reducing secondary complications and improving overall physical fitness.
I found that there were quite a few themes that came out that we didn't necessarily ask questions on. Later on, Dr. Ho and Dr. Krasyukov also talk about reducing those secondary complications. In episode 5 and 6, we discussed technologies for ABT, but Dr. Musselman first mentioned them in this episode.
When you think about the history and evolution of ABT, it really evolved through interventions like body weight support treadmill training and functional electrical stimulation, which, as Dr. Musselman said, were really game changers in the way clinicians approached rehab for people with SCI, because they could see that the potential that these therapies had and the outcomes that people with SCI were achieving by using them.
I thought it was really nice to hear from Kristen Walden, too, about how interest in ABT grew and the ABT Summit that was held in 2019 that brought multiple stakeholders together to develop priorities for improving the quality of and access to ABT in Canada. This has now evolved to become the ABT COP, or the ABT Community of Practice.
Mm-hmm. Kristen also talked about Praxis Spinal Cord Institute, which is a nonprofit that supports research towards a cure for SCI in Canada. I have to say, Dr. Musselman and Kristen, they've really led the charge here in Canada by bringing all the stakeholders together for that ABT Summit. And Praxis really helped to make that happen. Okay, so let's switch gears and talk about episode 2. So in this episode, we had the guests, Chris Rice, Andrea Nelson, and myself join, all of us individuals living with spinal cord injury who participate in ABT.
Yeah, I just love how Chris was able to take the progress he made in ABT and translate that to a real-life situation where he was able to dance with his friend who was the bride at her wedding. What incredible accomplishment and experience that must have been for him and for all of their family and friends watching.
Yeah, I know. That was really amazing to hear. And I really liked how he's been able to develop an ABT program at home so he can build it into his routine and fit it into schedule with all the other things that he's got going on. And Chris and Andrea both talked about the importance of doing ABT as early as possible in rehab. And they really emphasized that intensity that Dr. Musselman had spoken about in episode 1. Another thing is Chris also talked about the program that he follows, which he said encompasses ABT, along with like cardiovascular training and upper extremity training exercises, because really they all go hand in hand, especially when you think about full body exercises like crawling.
Yeah, I liked how Andrea was a little bit different and she spoke about the variety of exercises she does, like hiking and kayaking, and the creativity involved in her ABT. So for her, motivation is the key. And I really liked when you spoke about the changes in sensation that you experienced in your recovery, in spite of being injured for over 20 years with a complete injury. That was really exciting for me. And the other key point you stressed was that motivated mental effort when engaging and trying to activate muscles below the level of the injury and working to the point of muscle fatigue or mental fatigue to gain results. That again speaks to the high dosage. And I don't think a lot of people realize that it takes a lot of mental effort as well.
It really does. And absolutely, those were key things that I observed, while I was doing my therapy. I also thought it was interesting to see that all three of us have very different training schedules. They ranged from like myself, which is like 1 day a week, all the way up to 6 days a week with Chris. And, in addition, like the number of hours that we would train within a given time was also different. And yet we all noticed improvements. So I think it really raises some interesting questions like, could recovery be faster with a higher dosage? Or would it be to a greater extent depending on how severe the level of injury is? Another thing that I found interesting is that a lot of ABT can be done with very minimal equipment and really low-tech devices, which makes those home programs really feasible, which is great for people who live far away or from an ABT center or maybe don't have the funds available to attend an ABT center in their community.
Yeah. So another piece that's interesting is that you're also a researcher and you're looking at developing tools to track that participation and performance so we can start to figure out the optimal dosage and develop those standardized guidelines for delivering ABT. Now, I find there's a lot of knowledge about ABT and it's spreading, but now we're really seeing the details starting to come together.
Yes, it's been exciting to be a part of the process in adding to that body of knowledge in this field. Okay, so moving on to episode 3, and this is where we had John Cobb, Shane McCullum, and Sandy Marshall talk about the benefits and challenges of introducing ABT at different points along the care continuum. I remember John speaking about the importance of tapping into those family supports to assist with ABT in acute care because of the time constraints of therapists.
Yeah, I really enjoyed interviewing John. So he's one of those rare people that identified as a student that he wanted to work in acute SCI rehab. And now he's worked at Vancouver General Hospital for his entire career. So I put a lot of stock into his views about using acute care to introduce or prepare patients for ABT.
Mm-hmm. And, I like how Shane described the characteristics of patients that engage in ABT. Like, they can't really have comorbidities like current pressure sores or fractures, and they have to be motivated because the program is so intensive. And he also talked about the importance of connecting clinicians together through some sort of network so that they could really learn from one another.
I found that Shane is really interesting because as a physical therapist and research associate, he's at the forefront of ABT. And I have to say, don't discount smaller provinces because the Stan Cassidy Center in New Brunswick is really pushing clinical research boundaries with their partnership. And speaking about provinces punching above their weight, we also spoke to Sandy Marshall. She's a kinesiologist from Regina who started a pediatric program for ABT. So be sure to listen to this episode for an inspiring story about one of the kids.
Yeah, they're really all definite trailblazers in their field. I really liked how Sandy talked about bringing in other healthcare professionals and practitioners like kinesiologists and exercise therapists into our rehab centers in order to incorporate ABT into their programs and really help to lower some of the costs, which is a huge barrier. And that barrier also exists in the community. She mentioned that ABT is quite costly for families and not everyone has insurance coverage. And if they do, it may only be for a short period of time, which isn't enough since many people who are choosing to participate in ABT do it for the long term. Okay, so on to episode 4. And in this episode, we heard from you, Lovisa, and Dr. Cindy Gauthier talk about the research that you're all doing, looking at clinicians' perspective of ABT in the rehab and community setting. So I thought you did a really great job, Hope, in helping to break down the use of technology in ABT and the classes of technology used from low to high tech. You pointed out that it's really a combined approach where therapists are often pairing specific exercises with a piece of technology. And you also spoke about some of the barriers to accessing ABT and technology, as well as the need for resources and building a network for clinicians to connect with one another, very much like what Shane had mentioned back in episode 3. You also reiterated what John Cobb said too about implementing ABT in acute care and the importance of bringing it into our school curriculums to educate our PTs and OTs and kinesiology students so we can really try to help build capacity in this field.
I think that's really important. And something interesting that our listeners might not know is that the three of us, so Lovisa and Dr. Cindy Gauthier and I, work together providing different pieces for each other's research projects.
Yeah, when I was interviewing Lovisa and Dr. Gauthier, they both mentioned the same thing. And, Lovisa also emphasized several key takeaways from her study, the client-centered and goal-oriented approach of the therapist and the motivated mental effort that I had brought up as well that's used by participants. Also, the importance of weight-bearing activities and the high reps were all like important components of ABT. And she said there was lots of variability in how it's delivered and really like it's all about creativity, she said. Another thing too was the education piece. It also came up again through Lovisa and Dr. Gauthier's research regarding the level of knowledge and training differences across practitioners. So like between OTs and PTs versus kinesiologists. And also the importance to create behavior change within a profession to move the field forward.
Yeah, something that Dr. Gauthier touched on was mental health in this episode. And it wasn't something that was planned, but Dr. Ho talks about it in the next episode, and then Dr. Loyola Sanchez in episode 6. And of course, it is evident in episode 2, where you, Chris, and Andrea all engage in ABT, and you can just see how important it is to physical, psychological, and emotional well-being. For episode 5, these interviews took place over a number of months, and guests did not know each other's topics. So I found it interesting that in this particular show that was about intensity and high-tech devices for ABT, all of the guests, so Drs. Bogar, Dr. Ho, and Dr. Boyer, emphasized that no technology or simple technology can also be very effective.
Yeah, that's right. And, Dr. Bogar talked about the lack of intensity that currently exists in rehab, which is needed to promote neurorecovery. Yeah, we don't know what the optimal dosage is. So we know people are getting better, but they're not reaching their full potential. And another thing you mentioned too is that we know that technology can assist therapists to achieve greater intensity. And we also know that cardiovascular rehab is very important too, like ergometer training.
Yeah, and then Dr. Chester Ho mentioned the psychological benefits of FES cycling and benefits of using FES cycle in acute to reduce secondary complications and to promote neurorecovery.
Mm-hmm. Dr. Boyer spoke about the exoskeleton to help train and teach the body the movement of walking, to relearn to walk, and the ability to provide intensity that's reflective of ABT compared to conventional rehab. And he also mentioned the different types of exoskeletons that are available. And they're based, I guess, on a person's like level and severity of injury. The other thing that I thought was interesting is he also mentioned that there's actually 2 uses of exoskeletons. So one is really to relearn walking, or it could also be used like if you talk about robotics, like for upper extremity movements. So really used like as a training device. And then the other use really is more of as an assistive device to replace lost movement. So in that case, it would be something that's worn all the time.
Yeah, so another interesting topic that came up that's often used hand in hand with ABT was functional electrical stimulation. In episode 6, we go on to discuss more intricate types of stimulation. But in this episode, we learned that FES can be effectively used to support ABT as a handheld device or accompanying other technologies. So in combination with cycling or the exoskeleton.
So this is a great lead into episode 6, where we had Dr. Sukhvinder Kelsey-Ryan and Dr. Andrei Krasyokov talk about electrical stimulation. So Dr. Kelsey-Ryan gave a really nice overview about neuromodulation and specifically transcutaneous spinal cord stimulation. She spoke about how it could be used to restore leg muscles when the electrodes are placed on the lumbar spine, but also it can be used to restore hand function when placed on the cervical spine, which is really exciting. And another thing she said too is that most studies have occurred in individuals with incomplete SCI. So this is the spinal cord stimulation studies that she's talking about. But there have been a few studies that have also been done with complete SCI that have had smaller gains. But again, when you're talking about a tetraplegic, really small gains could actually translate to huge gains in function for them. And I think one of the really key points that really struck out with me from that interview that I did with her was when she spoke about how the spinal cord stimulation really has the ability to take someone from a 0 to a 1. So when she's speaking about that, she's talking about muscle that had absolutely zero activity, no movement whatsoever, and now all of a sudden activating it and triggering even a really small flicker of movement. Going from a 0 to 1 basically tells you that now you have something to work with. I thought that was just amazing.
Yeah, and speaking about spinal cord stimulation, we had Dr. Andrei Krasyakov, who talked about epidural stimulation. And epidural stimulation was originally used to treat pain in spinal cord injury, but now we're finding it can be combined with ABT to promote plasticity. But we have to show Health Canada that epidural stimulation can be effective for neuroplasticity too. It can be really expensive, and there are a lot of barriers to implementation right now.
So, when we talk about some of these barriers, what was neat is Dr. Adalberto Loyola Sanchez was on this episode as well. And he spoke about his concentric project, which is really looking to improve transitions in care. And so when he talks about transitions, it's those stages from moving from acute care to rehab and then rehab to home. And so trying to focus on those transitions by linking those hubs, so linking rehab centers with community organizations and trying to create this model or pathway of care. And this is something very similar to what's been happening and what they're trying to do in Ontario as well. And this is really important because he emphasized that these transitions, they really need coordination and continuity. Poor transitions really translate to greater health issues and a lower quality of care.
Yeah, so an interesting fact behind the scenes is that when the podcast was in the planning stages, we actually wanted to talk to one of Dr. Loyola Sanchez's patients if they had epidural stimulation abroad, but because of COVID, no one was traveling. So this group on episode 6 was actually a very passionate group. And one theme that came out to me was access to healthcare for Canadians. So there are so many facets to healthcare, not only testing the device, but getting it approved by Health Canada, and then having an open mind to learn and provide support for those people who have an intervention like epidural stimulation abroad. And then they really need access to ABT and support when they get back.
Okay, so this brings us to our last episode. So in episode 7, we had Heather Mills and Bean Gill sharing their personal journey that inspired them to open their own center and the things that they had to consider in doing that. It was really exciting to hear their stories about their journey through this. And in their case, it was really important to access funds and fundraise in order to support their center and to really build it. They talked also about the importance about social media and using it as a tool to really try to draw people in. Especially with Heather, she really talked about their social media being able to bring people in from out of province and even other countries to come there, which I thought was incredible. They spoke about the fact that it took a long time to get buy-in from therapists and referrals from rehab centers. And I think this goes back to what Dr. Cindy Gauthier was talking about with this behavior change that we need to really work on.
Yeah, and what I found interesting when I listened to the episode was that there was Project Walk in California, and they both went to Project Walk, and then Bean ended up going to Heather to get advice on how to set up a clinic.
I think also that, they both mentioned that importance of having really good, well-trained clinicians The other thing that I did talk about, which is great, that I know from my own personal experiences, the atmosphere at these centers. And it's really so important for clients' health and mental well-being. It's really upbeat and positive, motivating. And there's also like a really great peer support environment as well. Although you're training maybe a one-on-one or you with two therapists, there's a lot of other individuals at this center as well. So there's a lot of opportunity for those peer connections. The other thing that's great too is that ABT, it's available for all ages, all levels, all severities of injury. It's not just SCI. They have a lot of other neurological conditions that also attend these centers.
Mm-hmm. And I just wanted to make one final point. So our guests throughout the episode mentioned a number of resources and groups for spinal cord injury rehabilitation and ABT. So these are definitely worth mentioning again, so you can take a look or search them on Google. So first they mentioned Praxis Spinal Cord Institute. Then there's the Canadian ABT Community of Practice, the Spinal Cord Mobility Lab at KITE, Toronto Rehab University Health Network, SCIRE, which is a spinal cord injury research evidence, the professional and community websites, REU Paralysis Recovery Center, Walk It Off Recovery and Wellness Center, and First Steps Wellness Center.
So this brings us to the conclusion of this episode and this series. Thank you for listening. And for our listeners who have been with us for all 8 episodes, we want to thank you for tuning in to listen to each episode. If this is your first or your third, I would encourage you to listen to all 8 as they each cover distinct topics and provide some valuable information. If there's any topics that we haven't covered that you would like to learn more about, then please send us a message and we may consider it for a future episode.
If we've sparked your interest in ABT and you'd like to stay connected to learn about some of the exciting work happening in this field, I would encourage you to link to Spinal Moves and get more information about ABT and the Canadian Community of Practice at praxisinstitute.org, where you can sign up to become a member of the ABT COP. You can also listen to Spinal Moves on Spotify, Apple Podcasts, and other popular platforms. This series is sponsored by Praxis Spinal Cord Institute, a Canadian-based not-for-profit that leads global collaboration in spinal cord injury research, innovation, and care. Special thanks to the Saskatchewan Centre for Patient Outreach. Spinal Moves was created by Hope Jervis-Rademeyer, produced by Hope Jervis-Rademeyer, Praxis Spinal Cord Institute, and Anita Kaiser. The information provided on Spinal Moves is of a general nature and cannot substitute for the advice of a medical or healthcare professional. The opinions expressed on the show are solely that of the host and individual contributors. None of the individual contributors, system operators, developers, sponsors of Spinal Moves, nor anyone else connected to Spinal Moves can take any responsibility for the results or consequences of any attempt to use or adopt any of the information presented through this podcast.